Hi everyone, I'm Dr. Philip Ovadia, your guide to understanding the complexity of statins and their impact on metabolic health. Today, I'm going to break it down because most people are not fully informed about the effects of these commonly prescribed medications. Here's what we're going to talk about today. First, why statins might not be solving our heart health problems. Then we're going to dive into the deeper metabolic risks of taking statins. And finally, I'm going to let you know what you should be considering before picking up your statin prescription. So let's jump in. First, let's talk about why statins might not be solving our heart health problems. What we need to understand is statins do lower cholesterol. But despite the fact that statins have been widely prescribed for over 40 years now, and our LDL cholesterol levels are lower than they have ever been as a population, we see the rates of cardiovascular disease and other chronic illnesses continue to rise. And despite that drop that we've been seeing in average LDL cholesterol levels, over 93% of adults in the United States are not considered metabolically healthy. We all, including your doctor, need a deeper understanding of the impact of this poor metabolic health on driving the heart disease epidemic. And understand that while cholesterol may play a role in the development of heart disease, it is not the primary driver. Insulin resistance and poor metabolic health is the primary driver behind this epidemic of heart disease. That can be manifested with things like obesity and diabetes. And this is what we need to focus on, not lowering our cholesterol. Now, let's talk about some of the deeper metabolic risks of taking statins. Did you know that the risk of developing type 2 diabetes increases by 71% when you take a statin for the long term, even in people that don't have a prior history of diabetes before starting the medication? More concerning to me is when I look at the numbers related to insulin resistance in people on statins. I often see them developing increased insulin resistance over time. And this, as I mentioned earlier, is a primary driver of heart disease. So while we might be lowering some risk by lowering overall cholesterol levels, if we are driving people towards insulin resistance and type 2 diabetes, we may be causing more harm in the long term than benefit. Now, there are some other concerns related to statins. Many people develop muscle-related symptoms. And in fact, these muscle-related symptoms are related to the way that statins work. You see, statins interfere with our mitochondrial mechanisms. The powerhouses of our cells are negatively impacted by taking statins, and this can manifest with some of the muscle symptoms that we see in people who start and continue on statin therapy. There are also concerns around nutritional deficiencies and deficiencies of certain key elements like coenzyme Q10 that your heart relies on for optimal health. Ultimately, whether or not a statin is going to be a net benefit to your health is a very detailed discussion that you should be having with your physician. Unfortunately, many physicians are not in the position to have that discussion because they don't fully understand the risks and benefits that go into statin therapy. And they are just following blanket guidelines that are broadly applied to populations but may not apply to you as the individual. So that's going to lead us into our third topic today, what you should consider before picking up your statin prescription. I want you to understand the great influence that the pharmaceutical companies have had on the guidelines that doctors are told to follow regarding statin prescription. Most of the early studies that were done leading to the approval of statins were industry-led studies, and they were done in the days before data transparency was mandated. A lot of them have refused to release the underlying data that were published in those studies. Now, that doesn't necessarily mean that the statins don't work as the studies would suggest, but it certainly gives me concern. I also want people to consider the alternatives to statins. It turns out that today we have a wide range of medications that can lower cholesterol levels if it is determined that lowering your LDL cholesterol level is in fact going to be beneficial. There are non-statin alternatives that you should ask your practitioner about. There are things like ezetimibe and bempedoic acid, and we have PCSK9 inhibitors as well. There are a number of supplements that have also been suggested to be helpful in the lowering of LDL cholesterol levels. So, if it is determined that lowering your LDL cholesterol may be beneficial, talk to your doctor about non-statin alternatives. And finally, I want you to educate yourself about the important role that cholesterol plays in our bodies. Despite what you may have been led to believe, cholesterol isn't there only to cause heart disease or only to cause damage to our blood vessels. Cholesterol plays vital roles in the immune system and also is an important precursor to many of the hormones, like our sex hormones. So, understand that lowering cholesterol levels across the board, again, may have other ramifications. Now, I know you're going to have lots of questions. Statins are one of the topics that I get asked about most. And if that's the case, go to askdrphil.com. And there you'll be able to leave a question that may get answered by me and my team. Thank you for taking time to watch this video and for being an important part of our community. If you have any feedback or insights to share, please leave them in the comments below.